kind of doctor are you?
So I'm an orthopedic surgeon. Orthopedic surgeons have a bunch of different types. Mine tends to be, I do trauma, which means I take care of fractures. But then there's some other types that do sports medicine, pediatrics, things like that.
Mm-hmm.
And then your grandma had someone who did a joint replacement, so there's those kinds too.
Where do you work?
I work at West Virginia University Hospital.
All right. And what are the most common sports injuries?
So the most common in you want adults or kids?
Kids.
Okay, so in kids, fractures is the first thing people injure themselves while playing sports. They tear their ACL, so that's a ligament in your knee. Have you heard of that?
Yeah.
Okay. That's a pretty common one. And then the other thing is they injure tendons near their growth plates. So in kids, your bones have growth plates because you're obviously still getting taller, and that's a weak area in your bone, so it tends to get injured.
All right. And what sports do kids usually get injured playing?
Football. Football also has a big component of an injury that's not orthopedic, so they get concussions, which is more of a brain thing. And then soccer is pretty common. Gymnastics is pretty common, and basketball.
All right. And are sports that people play that are overspecialized are sports overspecialization injuries common?
They are. It's become more common for younger kids and even high school athletes to only play one sport all year round. And when that happens, you don't take a break from those specific activities, and so you are more likely to injure things by doing the same repetitive motion or repetitive activity over and over again. Mm-hmm. So one good example of that is baseball pitchers. So in Little League, I don't know if you know this, but there's a pitch count for kids. The point of that is to make sure that you don't do a motion too many times in a row and injure the growth plates in your elbow.
All right. So, do kids get more injuries because of repetitive motions from overspecialization?
Yes, they do. More often than if they had not overspecialized.
All right. In your opinion, is overspecialization in sports a good or bad thing?
It's probably a bad thing. They actually have shown too, I don't know if you know this, but like elite athletes, so football players in the NFL or NBA players, most of them actually played more than one or two sports in high school and when they were growing up. And so I think that if you play two or three different sports, you're giving some certain motions a rest, which allows it not to get injured. Because when you pitch a baseball, that's the only sport you do that in. And then if you play soccer and then basketball or track, then you get to rest certain things. So I think that the overspecialization is causing more significant injuries than there used to be.
Mm-hmm. And thank you for helping me with my project.